firstly, thank you very, very much to Rosemary and Young Epilepsy for hosting this event today. This was an idea born from the new UKRET Epilepsies Together network, which I'll take a few minutes now to explain to you who we are and what we do. And it's really exciting to be here together in person with many members of the fellow charities that have become part of this initial network here today, and to meet in person and to move forward with the work that we are trying to do together. But also, most importantly, to begin to raise awareness, as we were just saying with Amy, about some of these rare and complex epilepsies and how we can work together to make change happen. So, I am Alison Watson. You'll see me out there. I am a parent, first and foremost, of my son has ring chromosome 20 syndrome, or ring 20, one of the very, very rare epilepsy syndromes. And a couple of years ago, I founded, crazy woman that I am, UKRET Epilepsies Together, an informal network of patient groups, charities, representing those living and impacted by rare and complex epilepsies. And what do we mean by that? We mean those that are impacted every day by epilepsies that are refractory to medication, and as Helen very eloquently said this morning, associated with many comorbidities. So what she often describes as epilepsy plus. Why did I think about creating a network? Why would I want to take on more than I already do voluntarily? Well, I was working with Helen and within Epicare as the co-lead for the patient advocacy group for the last 5 years. I've just stepped away because there's only so much I can do, and I've taken a step aside to let others take on that baton. But I learned so much in the European space about other rare and complex epilepsies and the challenges and the opportunities that are out there. And also last year I was actually working with Rare Diseases International at global level, looking at rare diseases, and again seeing rare diseases are so very, very rare that we cannot just look at them just at a local level. We need to look regionally and then globally. But before we can take a world view, we have to look at what we do here within the UK on a national level, where we can make change within the framework and the fantastic opportunities and resources that we have within our own country. That's where we can immediately make change, and that's where this network has come together. So who are we? We're a collection of something like 25 UK-based patient associations or charities representing people with rare epilepsies, sometimes as well as general epilepsies as well, such as Epilepsy Action, Epilepsy Research UK and Epilepsy Scotland. We've all come together in the last couple of years to see what we can do as a collective, because the particular patient groups that represent for specific syndromes, our USP is being the experts in those conditions. We can provide the real world evidence in those conditions. We can connect the families and the patients together. But what we can't always do is drive change, because we're tiny. We're coffee table associations working often on a voluntary basis, with Facebook groups progressing to website pages and something a little bit more than that in some of the bigger charities. We're not big enough, not sustainable enough alone to really garner the interest of the researchers, garner the attention of all of the stakeholders out there to really make change happen. And we're interested in identifying more patient groups, and we know there are some out there that are not part of this group, to bring all of us together for collective change. So our aims: we want to work together to effect change for all of those impacted by these rare and complex epilepsies. And it's not just a medical problem. What I often say is when medicine doesn't have the answer yet, because it doesn't for many of these complex conditions, it's the impact on the individual and the family every day. It's how they cope day to day in their lives, how it impacts them in their social life, children and young adults educationally, impacts the family financially, impacts the adults as those move into adulthood, challenging, trying to get independence or trying to get into the workplace, and of course access to treatments, access to support, commonly big problems. It's not just treating the epilepsy, it's the whole holistic view, and it's the support for the individual and the family that's really key. We may represent individuals with very different etiologies, very different underlying causes for their rare epilepsies. And they are individual syndromes and individual rare diseases. But interestingly, whilst they're different, we have a set of very common unmet needs when we're trying to address the holistic problems. And we believe that together, we are one louder, bigger voice to effect change. So who do we want to target? Well, we're not targeting the individuals and the families, let's make that clear. We're not trying to provide today a support service beyond what we do as individual charities, and we're not trying to change that. In coming together as this network, we want to address the movers and shakers, the people that can actually make a difference to those lives. We want to talk to the policymakers and the payers, the researchers, the health professionals in the room, the regulators, pharma, the industry, the educators and the assessors. You know, all of these have a part to play in how we provide that support network to these families, how we can make change within the grand scheme of what's available today beyond necessarily the treatment to treat the seizures. Maybe there's treatments for other comorbidities. Maybe some of the other comorbidities are just as or even more challenging to the individual or their families. Maybe there are support mechanisms that would really benefit the families. Maybe behaviour is a big problem. Maybe mental health support could really help the individual or the family cope day to day. If we can intervene in those ways and provide those opportunities and get the access to those as a collective, we can make change to these people's lives. So how do we operate? We're an informal network today. We've been having quarterly virtual meetings via Zoom, and we discuss what initiatives can we do together to try and start to make a difference. Recently, in our last meeting about a month ago, we actually had some guest participants, and we would welcome any guest speakers, anybody that would like to work and talk to us collectively, because actually we think we're more interesting as a group than we are as individual organisations. And we had Charlie Stewart, who's recently moved over as head of patient engagement at Genomics England, come and talk to us, because Genomics England, where they're doing all of the work on the whole genome sequencing, and that's becoming more widely available, and look at how powerful that is, apart from the structural stuff, they actually want to look at rare epilepsies as a key focus, because Charlie has children with rare epilepsies, so he's got a personal input to this and very passionate about this. So Genomics England are really interested in talking to all of us about where are the challenges and what do we want from whole genome sequencing, and what does achieving a diagnosis mean? You know, let alone trying to get that diagnosis, but when you get it, how do you want that delivered? And how is that going to impact the individual and the family? And what needs to change in that messaging? And we also had at the same time Pete Oliver from NATA talking to us about gene therapies, because actually big companies like that want to talk to us in the round and not just the individual patient groups. And actually, these big companies don't actually know about a lot of the individual patient groups. They only know about the big ones. Let's get all together and give the smaller groups equity and opportunity and get seen and be on the radar so that we all have the opportunity to make change together. Because as we were hearing this morning, sometimes it's about, we ought to be looking at mechanism of actions rather than specific target genes, because actually there's some commonality going on there. So that's really exciting. And for those charities in the room, you don't even know this, but I've been having some really interesting conversations with a very large medical research charity this week, who again want to do a big piece of work with us collectively on rare epilepsies. And that's exciting news coming very, very soon. And also we had a shared stand for the very first time at the BPNA annual conference earlier this year. And we had some people come and visit our stand who want to talk to us about what difference we can make in terms of education of the upcoming epileptologists or epilepsy nurses, raising awareness, giving that input, and we'll hear this afternoon from some patient stories about how that can inform you about the impact of these conditions. So it's all about sharing knowledge and opportunities. So what have we done so far in the last couple of years? Well, here's a couple of pieces of work that we're kind of quite proud of that coming together. Well, not only I've just mentioned the raising awareness. You know, we're here today. Thank you very much again to Young Epilepsy for hosting this event today, and let's hope this is one of a first of events like this, whether it be Young Epilepsy or others, that really bring a focus to rare epilepsies together. But also, you know, having that shared stand, you know, some of us are too small to have stands at all the events and conferences to actually be seen and be heard by the researchers, by the clinicians. If we can do something together, you know, and we've done that as a first this year. But also a big piece of work that we've taken on, or a relatively big piece of work, is we recognise that Epilepsy Action recognised that epilepsy is one of the disabilities where assessments for PIP, personal independence payments, it was one of the worst disabilities for achieving a successful PIP benefit assessment. And we looked at the epilepsy criteria for people being assessed with epilepsy, and actually you compare that to some of the other conditions, and it's actually quite bland. So no wonder, you know, the assessors are not really understanding the complexities, let alone the additional complexities that are, you know, involved in these rare and complex epilepsies. So we took on creating a new assessment criteria, a new conditions insight report for rare and complex epilepsies. And that is now in the process of being adopted by ATOS and the educators that will be performing the assessments going forwards, so that they can perhaps better understand the challenges and ask the right questions, so that the families are perhaps more successful in achieving those benefits, and that's one less battle that they have to fight with. So we're quite proud that that might be coming to fruition. So we want some new activities going forwards. We want to continue to improve and raise awareness of the rare epilepsies. So if there's anything we can do with you or with anybody you work with, come and talk to us. We'd love to speak to you. We're also, potentially, we can talk to, we've started some discussions before, but we need to resurrect this with Genetic Alliance to campaign for more equitable access to treatment options, because we know there's a big difference between who can access some of the newer medications and who can't. But yet we know these are not precision medicines for Dravet syndromes, LGS, etc., etc. So, you know, something needs to change there, and we need to drive that change. And there's a big problem with registries, knowing, Helen spoke this morning about knowing where the patients are and understanding the size and scale of the problem of rare epilepsies. How can the NHS commission services? How can we know where to put those centres of excellence and what care coordination should look like, what those referral pathways look like, if we don't know how many people and what conditions they actually have, and how then that can drive the research agenda going forward. And then anything else that you'd like to come and talk to us about. So next steps. Well, we're an informal network, but I've actually commissioned, just kicking off this week, we want to create a new website for the network, so we have a presence and an identity online, and we've got some university students from the London Met University who are going to build that for us. It's kind of a bit exciting and a bit scary, because we haven't got any funding. We do this purely voluntarily on top of everything else that we do, but we're going to try and make this happen because we want to be seen and we want to be heard. So I think we then need to move this year towards formalising the network and creating a formal identity, because that may allow us to seek funding for some core costs to just keep this network going. You know, it costs, everything costs just to keep the lights on. Even if we do this all voluntarily, if we've got a website, it's going to cost us some money. If we need to be out there on shared awareness raising, that costs money to get us there. Why should the individual charities, some of them really, really tiny, pay for that? We need some funding. So if you know anybody that can help us with that, we'd love to talk to them, because I don't think we need a lot, we just need something. And we're going to work together to address the next common challenge. So, I'd like to finish on thanking you for coming here today, for wanting to learn and hear more about rare epilepsies. I'm Alison Watson. We are UK Rare Epilepsies together. Together we are stronger.